Welcome back to Good Day Stateline. Dr. Todd Cevene is back tonight from Rockford Pain Management. We're going to talk a little bit about arthritis, knees and shoulders, I hear, yeah?
Yes, bone-on-bone pain.
Okay, so tell us a little bit what arthritis, what osteoarthritis, what do those things actually mean?
Osteoarthritis or degenerative joint disease, it's when you get a thinning of the cartilage that happens if you scope the knee, or happens a lot of times with age. So as we age, the joints degenerate, and it's common in the knees, the hips, the shoulders. It's very common. So oftentimes it's referred to as bone-on-bone arthritis.
It sounds painful.
It is, yeah, it's not something, if you can avoid it, it'd be a good thing.
So what kind of treatments are available, you know, because this is something you should want to feel better, right? There's got to be some way to feel better.
There's a big push with insurance. So the insurance industry pays for this. There's a big push to keep people active. So what we don't want is if your knees hurt, you stop walking. If you stop walking, your tendency is to start to gain weight. You withdraw from family and society, and next thing you know, there's depression going on and everything else. So we want people really active. So there's a very high success rate. It's like, I think our clinic averages maybe 92% of success for the knees and shoulders, with your pain level being below a 3, doing what you like to do.
That's awesome.
Yeah, it's fantastic. That's pretty solid.
That's like how a lot of people feel every day.
Yeah, go to Vegas on those stats.
Yeah.
That's good. Very good.
So what kind of treatments are available?
We do a variety of things. We work with tendons, we work with ligaments. So if you're lying in bed, your knees hurt when you're sleeping, that's fixable. If you've had knee replacement and your knees still hurt, that's something that we can actually correct as a soft tissue issue around the joints. That can be corrected. There are nerve issues around the knees that can cause pain, so you can block the nerves and get rid of that knee pain for 6 months to a year, potentially permanently.
Wow.
As well. And we do a visco, like a gel, that goes inside the knee joint to give it a cushion, so the space between the knee actually comes open.
Okay.
And then if you can heal that cartilage, the cartilage will start to regenerate a bit over time.
Well, and a lot of people probably would think if they had a knee replacement, then that was the hope, and there's no hope after that, but you're saying there is.
There is, yeah. So knee replacements either go great or, you know, it's not that they don't go great, but sometimes they still have pain.
Sure.
So if you're one of those unfortunate people, then we can still save the knee. Or save you from pain, I should say.
Right? So it's FDA approved what you're doing, right?
It is, FDA cleared, yes ma'am.
Okay, so how long does that process take? Like, how do you make sure that what you're doing, you know, it's a good thing to be FDA approved? A lot of people looking to hear that, yeah.
Yeah. It's certified by Medicare, FDA cleared, paid for by Medicare and all insurance carriers.
Okay.
It's been around a very long time. I think it's been around maybe 28 years, 29 years.
So if somebody's watching tonight and they're like, my knees are killing me, they should
Your knees are killing you, you need to get to our office.
Yeah, and then what's the process like?
Once they come in, we'll do a consultation. That oftentimes can be done at no charge if somebody needs that, to make sure the process is going to work, they're going to get better. There's no downtime. It takes probably longer to walk to a room than it takes to do it.
Yeah.
It doesn't hurt at all. It's not a surgical procedure. It's a small injection that's numbed, so you can't feel it at all. It's quick. It's quick and it's painless.
This is probably a great time of year to get this done.
Oh yeah, definitely. Before the winter hits and the roads are bad, yeah, it's fast.
Yeah.
It's a few visits. It doesn't take long at all.
So that's what's happening with knees and shoulders? Is it the same kind of process?
Knees and shoulders both, yes.
Okay.
Knees and shoulders both. You can do it in the hip. Insurance will pay for knees and shoulders. They don't pay for it in the hip, but you can do it in the hip as well.
Well, that's good to know, though, because some people are like, well, I would love my insurance to cover it, but if they're not, I'd still love to feel better.
Feel better. Yeah, exactly. There's other options you can do.
Yeah, you have a lot happening at Rockford Pain Management,
It's busy. It's very busy. Yeah.
So this is a great time to give you a call and get things scheduled. Is there anything else you want to share with our viewers tonight?
No, I think that, again, if your knees are bothering you, then we got to strengthen the muscles. If you've got balance issues, that's really common as well. So what's just important is to get them happy. Get them out, get them moving, get them happy, get them around again, so they're not sitting at home. We don't want people sitting around.
No, we don't. And so if you're watching, you know, and you need this help, or maybe you know someone and you're like, I know someone who
you can see them at grocery stores. They're leaning on the carts when they walk.
Yeah.
Yeah, you see them when they're walking, they're kind of leaning on the grocery carts, or they'll shuffle side to side when they're walking. That's usually an indication of knee pain, or somebody that's got pretty bad knee pain.
Sure, and if this is happening in both of your knees, seeing that there's no downtime, can you do them both at once?
You can do them both at once, yeah, you can. A lot of times we'll do one knee and then the other, but you can do both at once. So it depends on the insurance carrier.
Okay.
So it's very common. It's common if you have pain in one knee, you'll probably have pain in the other knee. Sometimes it's not quite as bad, but it can happen in just one joint, but oftentimes it happens in two.
And do you recommend just like the one injection, or is it a process, a series?
It's a series of injections, so depending on your insurance, it could be 3 injections, it may be 5, it depends on the insurance carrier. What's important is we use a natural product as well, so the natural products seem to have a better success rate than a synthetic drug would. So, and we've got special cameras and x-ray equipment that will guarantee that the medicine is actually getting to the right spot.
Cool.
So it's really nice. It's got a very high success rate because it gives a lot of certainty.
Yeah.
As well.
It's
so.
always nice to hear that natural things are working better.
It is,
well.
yeah.
Yeah, that's good.
Yeah, glucosamine is something you could take. That's a pill you can buy over the counter, which helps, but there's a tipping point where it's not as effective.
Sure.
And it's just you can't get a dose high enough into the joints.
Well, and just come see you. You pretty much
then we'll knock it right out
all the
for you.
knowledge of the pain
That's
relief.
right.
Rockford Pain Management, Dr. Todd Cevene. Thank you so much for coming in tonight.
Yeah, yes, ma'am. Thanks for having us.
Coming up next, we're diving into the book, The Humane Table with Dr. Robin Ganzert, and then a new Let's Try It with Tam and Eve. We'll be right back.